Idaho Home Health, and I represent the home health component, which is the part that your physician orders. And when Connie references that they're the good people, I'm not sure how I take my conversation.
You poke people.
We only poke them when your doctor tells us to poke them. So I always want you to know that I really am a good person, and I'm really not going to come in and torture you and those kind of things. I have done home health for about 30 years, and the program that we do under home health, and the reason we start out by emphasizing what is non-skilled care, is that both entities get this phone call. My mom or my husband, or I'm going to be in the hospital and I need to know what care is available when I go home. Do you have somebody that can come and take me to the grocery store, that can come and cook meals? So we've decided with this panel that one of the things that we need to do is to explain to you, pretty much with everybody who sit at this table under home health, we may work with many of these, with these groups that are here. Home health is the entity that your doctor is the one who really guides. They're the ones who set it up either through your discharge planner at the hospital or maybe through your physician's office. And you're either recovering from an illness at home, or you have had surgery, or you have had just something happen in the home that you know that the care need is there. Our team consists of all of the groups that it has: physical therapy, occupational therapy, speech, dietary, nursing, social worker, all of those things that your doctor feels is really necessary for you in your home environment to be able to remain there. Home looks different now, and that's why everybody in this group will also explain to you is that under home health, we go into many of these arenas. We go into independent living. We go into an assisted living facility. Obviously, we don't go into a skilled nursing facility because that's what they also provide. So many people, unfortunately, have asked me about home health after the fact. They'll say, oh, I wish we knew about this when my mom was in the hospital or my wife was having surgery. Why didn't we know about this? So that's also part of our goal with this, is it's like that spare tire that's in the back of your trunk that you don't really look at because you're never going to have that flat tire. And all of a sudden you get that phone call that says, wow, you now have a flat tire, and it's associated with your health care. So that's why home health entity is usually set up by your physician. He says, this is what I think you need. We have a nurse that goes out, or a physical therapist that goes out and says, this is what we would recommend. We communicate that back to your physician, and they say, yes, that's what we need. That's what will help you get better in your home. We also sometimes help people transition. They're in their home, and maybe that's not the safest place for them to do. Frequent falls, not taking medications, needing therapy, et cetera, et cetera. We help families transition to another arena that might be their safe before they don't get to make that decision. You know, after you fall and you've broken something, is usually not as much of a guiding force as when you say, I don't want to fall, I don't want to break something. So home health can bring all those components together. A lot of people ask me, well, who's going to pay for this? How am I going to possibly afford to have all of these things? There's Medicare, and that's one entity at this time that there is a home health program. There's also under the Medicare Advantage programs. One of the questions that you need to ask when you sign up for your Medicare Advantage program, ask them the question, what if I need home health? What does it look like? Will I have a copay? Will I have, what will it look like? Or will you tell me I only can get care if I'm where I develop my plan? Medicaid also has provisions for home health. Many of your third-party payers, and we are seeing younger people all the time in home health, which either I'm getting older or they're getting younger, and I'm assuming they're getting younger one way or the other. So that's what home health looks like. It can you can have somebody under home health in there for 3 weeks. We have people that we've seen for an ongoing basis for years. It's usually that shorter period of time, and then we also work with the components of the non-skilled care. So that's what home health looks like. You have a right, when you want to have services set up, to ask who is going to be, how long have they been providing this care, what's their track record. There is an actual Medicare Compare page that will, if you type in the home health agency's name, it will bring up and it will compare them to everybody else who provides service in the area. I would encourage you to look into that to research it so that you know very clearly who's coming into your home, whatever that looks like. There's the variety of care sources. How do you get it and know that you have a choice? So if you see something happening like this, ask your doctor, what is home health? Would I qualify? How would I get it set up? Because across the United States, home health is home health. If they say that they are a home health agency, they have to be licensed, they have to be certified, they certainly will have report cards. So that's what home health looks like. If you have questions later, because I couldn't possibly, or I would get shut down by the group, to answer a lot of the questions. Okay? Thank you.